Hi, I'm Dani Gasparini, and welcome to this segment of One-on-One. I'm joined by Dr. Doug Zuckerman with Kaiser Permanente, and today's topic is heart health. I love that because we often sometimes focus on heart disease, but this is about heart health. So tell us a little bit about some of the misconceptions or perceptions about heart disease, and let's talk about the positive part of heart health.
Sure. You know, I think the main movement nowadays, and the main misperception that needs to be corrected is that heart disease is a disease of men. Mm-hmm. And even when I was a medical student, you know, when they give us the typical picture of a heart disease patient, it's usually an older man with a cigarette in his mouth, who's obese, and grasping his chest because he has nowadays, I think we're finding that the incidence in women is rising, whereas it's decreasing in men. And in fact, in women over the age of 65, heart disease is the leading cause of death.
You know, it's interesting. I've been involved with the American Heart Association for a long time, and we're really trying to bolster this awareness of women and heart disease. And I wonder, as we're becoming better at talking about it, does then the incident then rise because we're talking about, not the incident that rises because now we're having women have heart attacks, but as we talk about it more, we become more aware, and we're diagnosing it now more than we might have in the past because we're educating people about it.
Yeah, that's definitely true, and I think we're also seeing the prevalence increase dramatically because women do live longer than men, mm-hmm. and women are living to longer ages than they were in the past. So, but certainly there is a certain amount of more appropriate diagnoses where it may have been missed in the past.
Because I think it's great education. I mean, I think we're finally talking about it. It was sort of the secret that as women we didn't want to talk about. Tell us about the risk factors of heart disease. Women, men, what can we be doing?
The risk factors are actually quite similar in both groups. And the risk factors that we know of at this point are age greater than 50. In general, younger men do get heart disease at a greater incidence than women. So male sex is considered a risk factor. One of the most significant risk factors is family history of heart disease. Mm-hmm. So any primary relatives, meaning mom or dad, brothers, sisters, who have heart disease at a younger age, under the age of 55, you need to be very concerned because there's certainly a genetic component to the disease. Diabetes is an extremely strong risk factor, mm-hmm. and smoking, I can't say enough about smoking. It's an extremely strong risk factor, probably more so than any of the others I've listed. And then lastly, high blood pressure and high cholesterol mm-hmm. as well.
So then how does exercise, fitness levels, eating habits, all of that play into the risk factors?
Right. I think a lot of the mistakes that are made is we focus so strongly on medications and lowering blood pressure, lowering cholesterol with medications. And we often miss the fact that people aren't exercising and they aren't losing weight. And in fact, in most of the studies we look at, that can by far exceed the power of just a medicine or two. So it's extreme, losing weight and exercising lowers the blood pressure, lowers the cholesterol, increases the good cholesterol, and decreases the weight, and thereby decreases the chance of diabetes.
So let's follow the profile first of an individual who knows that there is heart disease in the family. Okay, what is the first thing that you might suggest for someone? Let's say they're in their 20s. Mm-hmm. They know their mom and dad or someone in the family has been diagnosed with heart disease. What do I do?
I think that person should be extremely vigilant about the risk factors we talked about, making sure that they get their routine annual exam, making sure that their blood pressure is properly controlled, checking their lipid panel, the cholesterol panel every year, making sure that their bad cholesterol, which is called LDL, mm-hmm. is very well controlled, probably more so than the normal individual. We want to aim for very low LDL cholesterols in people with significant family histories. And then, of course, avoiding smoking, making sure your weight is controlled, and controlling all of the risk factors.
I know that in heart health we've always seen just very typical campaigns on smoking cessation because it's so directly tied to heart disease. You and I were chatting previously about using that same kind of momentum and focus and education and really talking about being overweight, the obesity issue, lack of exercise, and health.
Yes. I think this is going to be seen as the next wave of public health. Whereas, we focused on smoking for a long time. It's a very, very significant problem, and I think we've made great strides in decreasing smoking. However, obesity is becoming an increasing problem. And with obesity comes all of the associated health problems of obesity: high blood pressure, high cholesterol, diabetes, and other problems like sleep apnea and arthritis. And these are debilitating diseases, much higher incidence of heart disease in obese people. And I think that's going to be the next major public health focus.
Right. And that is, obesity is certainly just a word. There are so many components that actually feed into that word. And it is about activity level and fitness level and having proper diet and proper rest and balance in life. So it becomes a very complex issue. In one sense, I think smoking was sort of a easy message, and that was stop.
Right.
Whereas this message and educational program is going to be a little bit more complex in how you educate people about it.
Yeah, I think it's certainly a much more daunting problem, but I think people need to realize that even small changes can have dramatic effects, and we've seen this in terms of exercise. People really think they need to go on a treadmill and run on a large incline for an hour a day in order to be calling that exercise. That's not true. I mean, we've found that a half hour of walking per day is almost as effective as higher level aerobic exercise. And it doesn't even have to, let's say you can't do 30 minutes of walking. We've also found that doing 10 minutes of walking 3 times a day is just as good as doing 30 minutes of walking continuously. So starting small and progressing as your abilities allow you to is the way to begin.
So then let's take the opposite profile. I'm an individual who I don't have any family members that have previous issues with heart disease. What do I do from a preventative side? I mean, we talked about the fitness and activity, but how can I make sure that I focus on my heart health?
I think diet is very important. We need to avoid the fried foods, fatty foods, and we need to try to maximize vegetables, fruits, legumes, and importantly, fish. Actually, we found that although fish does have fat, specifically salmon and those types of fish, it's actually a good type of fat, and it can increase our good cholesterol, which is called HDL. So I think if we maximize vegetables and fish and try to minimize the red meats, that's a significant first step.
I find it interesting as I sit here with you as a physician, a doctor, and you're saying that we want to try and stay away from prescriptions and drugs, that we're trying to do some preventative things. This is kind of a whole big shift in your own industry, I'm sure, in doing things in preventative health kinds of measures.
Yeah, I think it's very important to focus on the whole individual, not just specific lab numbers and targeting them with medicines. It's so important to focus on the lifestyle and focus on the weight loss and exercise, because that can prevent the need for all of these medications in the future.
I think what I'm hearing from you is it doesn't have to be an overwhelming and daunting task for us to achieve heart health. That one step at a time, and with every bit of activity and good food choices, we can make a difference in our heart health.
That's right. And one message I want to make sure I convey today, because the topic is women's heart health. And one thing I do want to make sure we get to the public is that women, this has been very well documented, don't typically present with what we think of as, don't always present with the typical type of chest pain. So let's say you're a woman in your 50s and you have a lot of the risk factors. We talked about perhaps diabetes, cholesterol, blood pressure. And you may not get the typical chest pressure that we think of in men. I've seen a lot of my patients that are women presenting with trouble breathing, or pain in the jaw, or pain in the left shoulder, or sometimes just not feeling well. They can't really pin down a specific symptom. And that, we can later discover that this was actually, a heart problem. So I think, especially if you're a woman who has a lot of the risk factors we talked about, be very vigilant about how you're feeling. And speak to your doctor if you have any concerns. Because
as women, we probably just think we're tired from vacuuming and not knowing that we really are in a dangerous place with our heart health. Thank you so much, Dr. Zuckerman. I appreciate it, and we'll see you next time on One on One.